Things are not looking good for the country as far as vital COVID-19 numbers are concerned. At this rate, the DOH says the Philippines could reach the peak number of COVID-19 cases by January and warns that if this trend continues, the surge this time could well exceed the one caused by the Delta variant. Mark Fetalco has the full details.
The Department of Health said the number of COVID-19 cases in the country could reach its peak by the end of January. Health Undersecretary Maria Rosario Vergere even warned of a higher number of COVID-19 infections than what was seen during the Delta variant surge last year.
Tinitignan natin na itong Omicron variant mukhang 8 to 10 times more transmissible than Delta variant. Tinitignan natin na kung magtutuloy-tuloy ang pagtaas ng kaso, maaari tayong makakita ng peak nitong mga number ng cases by the end of January. Just for information also, bukas makakapagtala tayo ng 10,000 mahigit na mga kaso, no? Base dun sa tinitignan natin ngayong mga laboratory submissions.
The Octa research supports this projection in conjunction with what they are seeing in other countries like South Africa, where cases are starting to drop significantly after 1 month. The group added the current spike in cases is similar to the surge seen last March.
It will be mostly sa NCR. Yung peak natin sa NCR ng Delta surge was 9,000. It's going to be easily surpassed with this wave. 10,000 or more, maybe even up to 15 or 20,000 cases. Sa NCR pa lang yan.
Based on the Octa report, the positivity rate in the NCR increased to a new record high of 34.7%, which is higher than the previous high of 29.6% recorded on April 2, 2021.
According to our experts, in order for us to be able to achieve the ideal na 5% or less na positivity rate, kailangan ang samples na natitest natin sa isang araw is mga 190 to 100,000. At malayo pa tayo dyan, although nung nag-delta tayo, nung tumaas yan, umabot na tayo sa 70 to 80,000 tests per day. At ngayon, niraramp up natin uli ang pagtitest natin.
Meanwhile, the Octa research said the hospital bed occupancy in the NCR increased to 29% from 17% in a span of 7 days, while the ICU occupancy also increased from 21% to 29%. According to Dr. Jose Rene de Grano of the Private Hospitals Association of the Philippines, the number of COVID-19 patients being admitted in hospitals in the NCR is also on the rise.
Nag-shift na sila. Nung bumagsak kasi ang cases natin, nag-close sila ng kanilang mga COVID areas. But now, nag-start na ulit sila na mag-open nung at least 20% of their allocated beds. So, they are anticipating na medyo baka tumaas pa ulit.
Due to the rise of COVID-19 cases in Metro Manila, the National Kidney and Transplant Institute announced that it will close its outpatient services starting January 7 until further notice. The Philippine General Hospital also recorded over 160 patients, up from just 30 cases on Christmas Day. Mark Fetalco for The Nation.